In this video, I'm going to explain why you, as a beginner in microsclerotherapy, should not inject leg spider veins around the ankle. Hello, my name is Dr. Haroon Gadraj. I'm a vein specialist with years of experience of running a successful private clinic. I'm here to offer training and coaching to healthcare professionals. Now, this looks easy, doesn't it? But let me tell you, it's not. If you're a healthcare professional and you've just started injecting leg spider veins by microsclerotherapy, you already know just how difficult and frustrating it can be to accurately inject leg spider veins. If you're just starting out, I strongly advise that you don't start with ankle veins, no matter how tempted you are. Why is this? What's so special about this area of the leg? Well, I'm going to cover the 4 major reasons why you should avoid injecting spider veins around the ankle. And please stay to the end, where I'll share with you my top tip for doctors and nurses who are starting in microsclerotherapy to help you inject more accurately. Now, the first reason you should avoid injecting leg spider veins around the ankle is that spider veins in this area are extremely close to the underlying neurovascular bundles. All the major nerves and blood vessels entering and leaving the foot are right under the skin in this ankle region. The number one mistake, the big error that many beginners make, is to inject too deeply. So for this reason, the area of the leg is particularly vulnerable to inadvertent and accidental injections into arterioles. Sometimes even arteries, with disastrous consequences. Now, inaccurate injections, which are too deep and which put sclerosant into an artery or an arteriole, can lead to major tissue loss in the foot. I've been asked to give expert advice when injections around the ankle have led to amputation of toes or parts of the foot. So beware. The second reason is that even extravasation of the sclerosant within the skin can cause prolonged sensory neuritis. Now, skin blebs, that's the hallmark of extravasation. Skin blebs are painful even in themselves, and if injections are painful, it's an indicator that you should stop. Now, extravasation around the ankle can cause pain for weeks and months if a superficial sensory nerve becomes inflamed by leakage of sclerosant, and this is much more of a problem and more likely to occur around the ankle because the sensory bundles are so superficial. Now, the third reason is that small ulcers and scabs in this area can be very slow to heal. It's well known that the ankle and the foot heal much more slowly than the face, for example, whatever the cause of the injury. Now, fortunately, skin loss and ulceration following microsclerotherapy are very rare. However, as a beginner, all complications are obviously going to be more frequent, and a small scab on the ankle will take a lot longer to heal than one on the thigh. Now, the fourth and last reason I'm going to cover is that spider veins around the ankle are often associated with superficial venous reflux. In fact, the condition corona phlebectatica, which is a cluster of spider veins around the ankle, as shown here, may be the only sign of superficial venous reflux. And the association between superficial venous reflux and spider veins is greatest in this area of the leg compared with, for example, the outer aspect of the thigh. Superficial venous reflux should be suspected in all cases where there are spider veins around the ankle, and it's vital that this reflux is addressed before spider veins are injected. So for this reason alone, most experienced specialists will advise that patients with ankle spider veins should have a full assessment by duplex ultrasound. So there you are. Those are the 4 major reasons why, as a beginner in microsclerotherapy, you should avoid injecting leg spider veins around the ankle. Now, at the beginning of the video, I told you I was going to give you my top tip for accurate spider injections. Well, as a beginner, the tendency is for you to inject too deeply, and that's why injecting around the ankle can be so dangerous. The injections can even be so deep they go through the spider veins and completely miss them. Therefore, I advise as a beginner you start off by bending the needle 10 to 15 degrees, place the needle flat on the skin with the bevel up and slide the needle forward. And this tip will ensure that your injections remain very superficial, and as a beginner you will avoid the trap or the danger of injecting too deeply. This will increase your injection accuracy and reduce the risks of injecting nerves and blood vessels deep to the skin. When you get experience, like the specialist injecting here, you can use a straight needle. In the description box below, there's a link to my free mini course, How to Inject Leg Spider Veins and Blue Veins by Microsclerotherapy, where you'll find more tips for successful injections. Thank you for staying to the end. If you found this video helpful, please consider hitting the like button. It really helps my channel. And check out all the links in the description box below. And why not subscribe by clicking the button here, and that way you won't miss my next video. Thank you for staying to the end and watching. I look forward to seeing you again soon.